ايه هسه دا يسجل دا يسجل. اوكي
سجل. اوكي
اوكي
ابدا من البدايه يا عم، وارجع على السلايدين الاوليه واحكي حبيبي. يلا بابا يلا.
Shoulder femoral joint. Type of it is ball and socket synovial joint. So it has multi-axial movement, and the joint is most susceptible to injury. It's formed by the two articular surfaces, head of humerus and glenoid of scapula. Head of humerus is 4 times larger than the glenoid. So to correct this, there is a rim of fibrocartilaginous, which is called the glenoid labrum, thickness about 3 mm. It increases surface area and deepens glenoid fossa. Shoulder joint is completely surrounded by the capsule, attached medially to the glenoid fossa of scapula and laterally to the anatomical neck of the humerus, and extended for a short distance to the side of the humerus. There is an axillary pouch, which is an inferior portion of the capsule. This area is most common site for accumulation of fluid in case of effusion and hematoma. It's not reinforced by the muscles and ligament. Synovial membrane line the fibrous capsule, form the tubular sheath around a tendon of long head of biceps, extended through the posterior wall and of the capsule to form subscapularis persi. This is the synovial membrane, which is surrounded as a tubular sheath long head of biceps. So the long head of biceps muscles is an intracapsular extrasynovial part. The persi, which is an fluid-filled sac, it helps for reduce fractions. It has 4 types: subacromial, below the acromial size, and subdeltoid persa. This persa is the longest persa in the body and not communicated with the shoulder joint. And then is another persa which is called subcoracoid, is the process, and subscapular, which is below of subscapularis muscles. Ligament, which also support shoulder. There is a glenohumeral ligament. It's formed 3 parts: one superior, and middle, and inferior, which is attached medially to the glenoid and laterally to the anatomical neck of the humerus. There is another ligament which is called the shoulder joint superior. There is another ligament, coracoacromial ligament, attached from the coracoidal process to the acromial side. Also, it's protected shoulder superior. There is another factor that will help the stabilization joint, which is muscle. This is the anterior view of shoulder joint. This is the posterior view of shoulder joint. Rotator cuff muscle helps stabilization shoulder joint. This is the subscapularis muscle from the anterior view, attached from the scapular fossa and attached to the lesser tuberosity of the humerus. This is the only muscle from rotator cuff attached to the lesser tuberosity. There is a muscle, supraspinatus muscle, infraspinatus muscle, and teres minor. All the 3 muscles attached to the greater tuberosity of the humerus. There is another muscle. There's another muscle here, the stabilization joint here, teres major muscle. This teres major muscle is attached to the crest line of lesser tuberosity of the humerus. There is also a muscle called coracobrachialis muscle attached from coracoid process to the lining crest of the humerus, and there's the deltoid muscle, which is the most important muscle and the largest muscle, attached origin from the clavicle and scapular spine to the deltoid process of the humerus. And also biceps brachii muscles help stabilization joint, which is attached intertubercle group and then attached to the supraglenoid tubercle of scapula. And there is latissimus dorsi muscle, which attach to the line crest of lesser tuberosity of a humerus, and the muscle pectoralis major muscle attached to the line crest of greater tuberosity of a humerus. بس عم الصوت واضح؟
مو كلش واضح، يغوش
لا
يغوش صوتك، مغوش.
إذا هيدفون يكون أوضح.
لا هو أنا أصلا الهيدفون يعني.
أنا أشوفه واضح.
اكو صدى كان قبل شويه يقطع
وشدوا
الصوت.
المايكات ولا احمد شدوها. كل المايكات تبقى بس هي دكتوره.
العفو دكتورة، ما تقدرين توخرين السماع يعني المايك يعني تحكين بدون هيدفون.
أوكي هسه حاول. أوكي بس موضوع. أوكي عم نكمل.
اي اوكي كمل.
Okay. So there is a blood supply بالنسبة للشولدر joint. It's blood supply from anterior circumflex to humeral vessel, posterior and suprascapular vessel and subscapular vessel. And nerve supply axillary nerve, subscapular nerve, musculocutaneous nerve, which is a branches from posterior division of a brachial plexus, carry fiber from C5, C6. بالنسبة blood supply is a branches axillary artery from the third division. So the axillary artery is a continuation from subclavian lateral to the first rib, continue as axillary artery. Have a three branch divided by pectoralis minor muscle into number one is the superior thoracic artery. بالنسبة second part become two branches اللي هي thoracoacromial branches and lateral thoracic artery. Third branch اللي هو supply shoulder joint from anterior and posterior circumflex humeral artery and subscapular artery. So it's continuous axillary artery inferior border from teres major muscles to become continuous as the brachial artery. Radiological feature shoulder joint أول شيء هو الإكس-راي. AP standard view to show the normal anatomy of the shoulder joint is the true AP view to the patient with the arm is position, low neutral position, low internal or external rotation will be concentered on the coracoid process. This is the AP view, the normal shoulder joint. From that humeral head and the glenoid, there is a half moon alignment between them. So if there is an increased distance, it means there is a dislocation. There is a acromion, clavicular joint, on the humeral side. This is the body of scapula and the lateral border of scapula. Scapular Y view can be taken in erect or supine position in the PA direction. With the affected shoulder, you can rotate it 45 degrees. The arm's position at the side, you can superimpose of scapula. This is the normal anatomy of scapular Y view. The Y view حيكون هنا scapular neck والcoracoid process والbody of scapula. حتكون الجلينويد this rounded agent and this humeral head يكون overlap الجلينويد بالnormal position. بالنسبة للأكسيلاري فيو يكون patient يكون supine والarm يكون abducted 90 درجة ويكون الإكس-راي beam is approximately 30 degrees toward the spine with the beam centered on the middle of a glenohumeral joint. So it's the normal of the axillary view like a gold ball appearance. هيكون البول هو الhumeral head وهيكون التو فينجر هي الcoracoid process and the acromion region وهذا راح يكون هو الجلينوid. So there is an cases of anterior dislocation in the shoulder account for 95% of the cases. There is most يكون الhumeral head in alignment with the glenoid. In cases of anterior dislocation, there is يكون humeral head below the coracoid process and medially. This is after reduction cases. In case of 5U, and the humeral head must overlap the glenoid, so it will start below the glenoid and medially. This is after reduction cases. In case of posterior dislocation, it's difficult to see because the internal rotation of the humeral head يكون شكل light bulb sign, بس يكون widen spaces between the humeral head and the glenoid. So تكون أوضح إنه تنشاف بالscapular Y view إنه هنا الhumeral head يكون below the glenoid and laterally. This is the posterior dislocation in the shoulder. In case of anterior dislocation in the shoulder, case of recurrent, there is 50% of the cases there is a Hill-Sachs lesion occur in posterior lateral part. Hill-Sachs lesion is caused by impaction of a humeral head against the rim of a glenoid. So it is after reduction هيكون leave the groove, which is called Hill-Sachs. Not have any clinical significance, but maybe cause loose body build joint. And in case also of recurrent dislocation هيصير إنه pancreas lesion اللي هي anterior inferior injury بالنسبة للglenoid hernia. من الأشياء اللي تنشاف هم بالإكس راي الكالسيفيكيشن بالشولدر جوينت. هنا حيكون كالسيفيكيشن بالسوبرا سبينيتس مسل اللي يكون inserted الجريتر tuberosity. بالنسبة للأريثروغرافي بالنسبة للشولدر هيكون injection للكونتراست through the joint spaces تكون opacify the sides of the parasite and not in this cases not be seen because it is not communicated with the shoulder joint. So in case best to see the subacromial parasite become injected by case of subacromial perisography under ultrasound or fluoroscopic guidance هيكون نشوف هنا subacromial subdeltoid parasite not communicated. In case of ultrasound, we use a high frequency probe. تكون preferred in suspected rotator cuff pathology. More than 90% sensitive and specific rotator cuff tear, comparable to MRI in evaluation of full thickness of rotator cuff or bony pathology not will be seen. Advantages: no ionization radiation, no contrast agent, inexpensive and guided aspiration and injection possible. But limitation: less sensitive for reduction with partial thickness, rotator cuff tear, and also cannot completely become evaluation labral ligamentous complex. In this position with the arm, يكون بكي حالة internal rotation والelbow يكون flex 90 درجة. In axial view هنخلي البروب هنا. هنشوف البايسبتال long head of biceps muscle and biceptal group بين greater and lesser tuberosity of humerus يكون echogenic. This is the deltoid muscle. This is subcutaneous and the skin. A longitudinal section هنشوف إن long head of biceps muscle يكون hyper-incline من fibrillar part in subcutaneous tissue. Slide the probe more superiorly below the coracoid process. There we can see in the coracoid process in the subscapularis muscle we can attach the lesser tuberosity of the humerus. This is the deltoid, this is the subcutaneous fat and the skin. Slide the probe lateral when the long head of bicep muscle leave the glenohumeral ligament. This is areas called the rotator cuff interval. هيكون a long head of biceps between subscapularis muscles medially and supraspinatus the coracohumeral ligament and the ligament here that called superior glenohumeral ligament.
and this is also the deltoid, subcutaneous, and skin. With the arm, put the arm posteriorly on the iliac crest وslide more laterally عن الcoracoid process. هنشوف supraspinatus muscle. This is supraspinatus muscle inserted with greater tuberosity. هيكون hypoechoic region. This is the articular surface بين supraspinatus and the deltoid. This area is called subacromial deltoid bursae. Posterior will put the arm to be attached to the opposite shoulder. هنشوف tuberosity and below the deltoid muscle. Slide the probe more medially, regular in shape, just indentation. وهنا هنشوف spinoglynoid notch اللي هي suprascapular neurovascular. من الباثولوجي اللي راح نشوفها هيكون اكو fluid surrounded the long head of biceps اللي احنا كنا بين the greater and lesser tuberosity of humerus. This is the indirect sign of rotator cuff pathology. This is also can be seen a tear in the supraspinatus muscle. يكون pride ويكون الارticular surface هنا يكون pride than adjacent when there is a tear. This is also another example of the partial tear. The joint can be seen. This is a case of supraspinatus muscle, so tendinosis. تبين أكو microcalcification يكون heterogeneous in textures are represented. بالنسبة للMRI, high accurate for evaluation of rotator cuff pathology. So it's no ionization radiation non-invasive ونقدر نستخدم multiplanar image. حيكون اكو بالنسبة للبلان راح نستخدم الكورونال اوبليك واكزيال وساجيتال. coronal image نحن نشوف إنها supraspinatus muscle يكون attached with greater tuberosity of humerus. We can see now circumflex scapular artery and vein, inferior glenohumeral ligament ونحن يكون anterior circumflex artery and vein. بالنسبة للتندون of supraspinatus يكون من all sequence يكون hypo intense. إذا كان bright معناته إنه أكو tear. Another section بالنسبة للcoronal هنشوف إن infraspinatus tendon more inferiorly ويكون attached to greater tuberosity of the humerus. This is the infraspinatus inferior glenohumeral ligament. بالنسبة sagittal section, sagittal oblique view هيكون بين spine of scapula and the coracoid, and this is a glenoid. Between them there is supraspinatus muscles and inferior infraspinatus muscle. هنا حيكون subscapular muscle section. حنشوف بين الجلينويد and spine of scapula حيكون هنا supraspinatus muscle، حيكون هنا infraspinatus muscle and raised minor muscle. وهنا حنشوف middle glenohumeral ligament اللي تكون hypo intense. بالنسبة للأكزيال section إنه لازم يكون بالأكزيال section حيكون التندن أو supraspinatus muscle يكون parallel للمسلز مالته. راح نشوف هنا deltoid muscle وهنا بالأكزيال لازم نشوف الspine of scapula. This is another section. هنشوف إنه يكون التندن بالأكزيال view يكون surrounded بالhumeral head. هنا حيكون infraspinatus tendon, supraspinatus tendon, biceps tendon, and subscapular tendon. This is the superior glenohumeral ligament. بالنسبة للليبرم of glenoid بالأكزيال section يكون triangular in shape and يكون hypo intense. There is another view which is called abduction external rotation view. In this view, it must be excellent for assessing the anterior inferior labrum at the 3 to 6 o'clock position. اللي هو أكثر كمان sites for the labral tear are located. In this case بالview هنشوف هنا اللابرم يكون also triangular in shape. This is the anterior labrum. This is the posterior labrum يكون hypo intense. This is هيكون superior glenohumeral ligament. This is subscapular muscle and supraspinatus tendon. Labral tear, there are many labral variants. Their normal variants are all located in 11 to 3 o'clock position, like sublabral foramen, sublabral recess, and Beaufort complex. It's important to recognize these variants because they can mimic slab tear, superior labrum from anterior posterior tear. This normal variant, which normally not mimic a pancreas lesion. البانكارت region أكثر مكان يصير بها from 3 to 6 o'clock position. The normal variant now doesn't occur. بالنسبة sublateral recess واحدة من normal variant become a 3 attachment of superior labrum at the 12 o'clock where the biceps tendon can be inserted. فيها 3 type. التايب الأول no recess between the glenoid cartilage and labrum. التايب الثاني حيكون small recess. التايب الثالث حيكون large sublabral recess وهنا يكون difficult to distinguish them from slab tear. This is the MR arthrogram T1 and T2 image with fast saturation. حيميزنا بين sublar recess and slab tear. هنا حيكون sublabral recess diameter أقل من 3 ملم يكون smooth outline. بالنسبة للتير حيكون irregular outline يكون larger than 3 ملم. بالنسبة للسابلابرال foramen which is another normal variant هي عبارة عن detached labrum at the 1 to 3 o'clock position which accounted for 11 of individual patient. This case of sublabral foramen اللي هو هذا حيكون detached labrum from the glenoid. A case of sublabral recess. This is the case of sublabral foramen. هنا حتكون أوضح إنه يكون شلون detached from the glenoid وهنا هاي الأريا هي middle glenohumeral ligament. بالنسبة للبافورت complex is a